everybody, Dr. Mandy, getting on today to talk about 8 otologic warning signs you should never ignore. But before we talk about what those are, if you hit the bell at the top right hand side of our page, you'll subscribe and then you'll get any alerts for any new videos that come out. Okay, so what are the 8 otologic warning signs that you and your healthcare provider should never ignore? Number 1 is deformity of the outside of your ear. This, I think, would be more appropriate for those in children. So if you're seeing somebody with an outside ear that has it looks a little deformed or abnormal, sometimes that can be a sign of hearing loss or something bigger. So never ignore those signs. If you experience a sudden hearing loss in a short amount of time, within 2 to 3 months, that is definitely something that you need to be seen by a hearing care professional about. Sometimes those sudden hearing losses could be something as simple as earwax blocking the ear, or it could be something further as a virus that maybe if you had an upper respiratory infection, you may have gotten a virus that attacked your hearing nerve and you want to get treatment as soon as you can to try to recover some of that hearing. Active ear drainage is definitely something you do not want to ignore. So if you've got pain or drainage of your ears, then you definitely need to be seen by a healthcare professional. What that could be, it could be an ear infection if you had a head injury. It could be spinal fluid leaks. So you definitely, if you've had anything eventful and you start seeing some of these symptoms, you definitely need to be seen. So going along with number 4, kind of with number 3, if you have any ear pain, you definitely want to be seen for that too, because that could also be a sign of an ear infection. If you have a sudden onset of vertigo or dizziness, you definitely want to be seen for that. There could be a multitude of reasons why a sudden onset of that could happen. We could be talking about ear diseases, we could be talking about balance problems, other disorders away from the ears, so something to be aware of. If you have a foreign body in your ear, you get a bug, you get a child who gets a bead or something in their ear, they definitely need to be seen to get that taken out. The other thing is recent onset of hearing loss in one ear, not necessarily both ears, but one ear. That is definitely a sign that you need to be seen. If you had a hearing test and your healthcare provider is noticing a type of hearing loss which is conductive, you definitely need to be seen by an ear, nose, and throat, or if you're seeing somebody that's not an audiologist, be seen by that. So those professionals are going to have to look at that audiogram and determine if you have a conductive hearing loss or a sensory neural hearing loss, which is permanent hearing loss. If it's conductive and it's not very obvious of what's causing that conductive component, then you definitely need to be seen. So those are the 8 otologic warning signs that you need to be aware of. If you have any questions or you're not sure if you're exhibiting one of these signs and you want some answers or just want to talk about it, call our office at Sioux Falls Audiology 306-3050, or send us a message through our website. We're also on Facebook and TikTok, so there's several ways to get a hold of us. Well, we're going to head out now, and we'll go chat with you later.
We are here to help. If you want to chat with Dr. Mandy, go to SiouxFallsAudiologyAssociates.com.